Hey, how are you guys doing? My name is Dr. Armagan Sumro. I'm an interventional cardiologist here at Arkansas Heart Hospital. I've been in practice for about 3 years now.
I'm Andre Paischow. I'm a cardiologist at the Heart Hospital. I practice general cardiology as well as interventional cardiology.
Hey, I'm Peyton Card here at Arkansas Heart Hospital. I'm an internal medicine doctor. I've been here for about the last 5 years where I've treated patients in the hospital and in clinic. Did the COVID unit back during that time period, and I'm happy to hang out today with you guys to discuss some online trends that we're seeing.
Oh no, defibrillator.
Hey, Toby.
Hey,
Put her there.
what?
Put her there. Let's just let bygones be bygones.
Why are you smiling, laughing? Weird.
I'm just excited about Shay being friends.
Okay. What was that?
Oh, come on.
Yeah, if Michael Scott is doing it, I
No.
don't think you should do it. That's pretty much as simple as that.
Like in this clip, he's using an external defibrillator, like you might see in a first aid kit at a ball game or something like that. And those, if they are used in the wrong time, actually can be harmful. And so most of the ones that you'll see at public events and things like that actually have programming involved to try to let them only go off at times when they can be helpful and not at times when they could be harmful. And so I think there is a little truth to this, but knowing when to use these devices is kind of the bigger thing.
I think I'd probably just, if Dwight and Michael Scott are doing something, we probably should not be doing it. I think that's just all I'll say there. Love him, but I don't think I'd aspire to be Michael.
Majority of all heart attacks and strokes occurs between 6 a.m. in the morning and 12 noon, all from a main cause of dehydration. So make sure you're drinking a glass of water before you go to bed. This will thin out your blood, cleanse your lymphatic system, and help your liver. And most of all, it will keep you healthy.
Yeah, I do think drinking water is a great idea, but I'm not sure I would go as far as to say it can prevent heart attacks.
Okay, I don't think there's any scientific validity to most of what he said.
So first of all, staying dehydrated is not good for your general health, and staying hydrated pretty much helps everything in your body.
Drinking water doesn't really change the viscosity of your blood, doesn't make it you any more likely or less likely to have a blood clot or plaque rupture, platelet-mediated event like a stroke or heart attack.
As far as that causing heart attacks and during a certain time of day like he's talking about, I don't know that that necessarily would be correlating with that.
There's some circadian variation in the incidence of strokes and heart attacks that has a lot to do with how our bodies are wired. There's a slight surge in stress hormones towards the beginning of the day. However, you're not going to prevent any of that by staying hydrated. Heart attacks are caused by the things you would imagine. They're caused by unhealthy lifestyle, some genetics, aging.
Taking your medications regularly if you're a high-risk patient, seeking help appropriately, exercising, not smoking, adhering to other lifestyle measures is probably the way to go as opposed to just drinking a couple of glasses of water at night. I would probably disagree with this one.
So unless somebody has told you to avoid excessive fluid intake, staying hydrated is in general a good thing to do, but I would not count on that preventing a heart attack.
They call this the 1-minute health check. All you gotta do is take a spoon and rub it all over your tongue.
This is going to be fun.
And then you put the spoon in a bag and then place it under some light for about a minute. And you're technically healthy if you pick back up the spoon and it's clean, no blotches or odor. But if it does smell kind of sharp, there could be an issue with your stomach. If it has orange blotches or smells like ammonia, there's problems with your kidneys. And if it smells sweet, you might be a diabetic. If there's any white blotches, that could mean a respiratory infection. If there's any yellow blotches, that could mean an issue in your thyroids. And if the blotches are purple, you should get your cholesterol checked. All hail Dr. Spoon.
So I think there's a couple things she might be zeroing in on in this clip with a couple of these symptoms potentially, but there's also some things that definitely seem a little off base with using a spoon as a diagnostic tool.
That's pretty creative, but again, I don't think there's any scientific validity to that. I wish it was that easy to diagnose all these conditions.
Seems kind of voodoo-ish to me, but
I definitely would not trust any of your actual medical diagnosis or symptom evaluation on using one of your spoons at home.
I'm actually wondering what happens if it's rainbow.
You or someone you love have problems remembering things. Memorizing isn't coming as easily to you as it used to. If you tuned in and saw my last viral video, you would know that we were talking about high cholesterol. And I really appreciated this comment because Marty was saying how the brain is made out of cholesterol. So why lower it? I loved this question because cholesterol was something I never really cared about until my dad was diagnosed with high blood pressure. High blood pressure and high cholesterol are linked together. There may be a lot of voices saying that it's not real, it's nothing to worry about, but this is why you should be aware of it. According to the National Library of Medicine, the brain contains 20% of cholesterol in your body. This cholesterol is important because it helps with regulation of ion permeability, cell shape, cell interaction, and transmembrane signaling. The two main types of cholesterol are HDL and LDL. HDL cholesterol is produced in your liver. HDL carries the LDL away from the arteries and back to the liver. That's where the LDL is broken down and flushed away from the body, labeling HDL the good cholesterol. Yay! LDLs are the ones we want to look out for. They are mainly found in foods we eat, specifically foods with trans and saturated fats. Not only does it clog our arteries with plaque buildup, causing heart failure, heart attack, kidney disease, this plaque will also build up in the arteries in our brain called atherosclerosis, putting strokes on the list, along with other very scary diseases that your brain can suffer from. So how do you lower it?
Yeah, so this is a little bit of a mixed message here, I think, I would say.
So I think in general, especially in patients with heart disease and kind of the classic metabolic syndrome that we talk about with patients, where you have a lot of times a combination of heart disease, high cholesterol, high blood pressure, overweight, potentially diabetes. Managing cholesterol is an important piece of all of that. And some of the things she's saying are true in that, cholesterol levels are important and they do lead to certain plaque buildups in your body if you have too much of the bad types of cholesterol.
It's been seen that overall, with respect to health outcomes, LDL, the lower the better, because it prevents events which are more likely to cause people to have significant morbidity or death, such as heart attacks, strokes. So generally, lowering your cholesterol is the better way to go about it. I would probably not agree with the fact that it can cause probably brain dementia or any problems or concerns like that. This is so far seems to be a myth.
Getting your levels monitored and treated appropriately is important when trying to look at your whole body's cardiovascular health, whether it be in your heart, your blood vessels, or in your brain. And so I definitely think that some things she's talking about are worth taking note, and some things might be a little extreme, but talking to your provider about your cholesterol levels is an important thing to look into.
What's the deal with everyone wanting to lower their heart rates and not going to cardiologist?
If you're having that big of issues with your heart rate or other potentially cardiac symptoms, I think getting checked out would be the more important thing.
Lowering stress and anxiety will lower your heart rate variability. Now, heart rate variability basically measures How much the spaces between heartbeats will vary. It's usually a measurement of your autonomic health, so your parasympathetic tone. If you use a wearable, it checks it at night and spits out a number every morning. It correlates with fitness level and overall health. There's some thought there that cold exposure and cold baths and things like that will improve overall health. There's some data that it does increase heart rate variability. How much of that impact is true versus just the low quality of the studies, I honestly don't know.
Definitely something that people should look and keep an eye out on their heart rate. I'm not sure if I would agree if these ways would probably work too much.
So I think kind of the big things that I take away from this today is that, especially in a lot of these clips, there's some recurring themes that, you know, people are wanting a quick fix for a lot of the same symptoms of, you know, feeling like you're potentially having panic attacks or having out of control heart rate or overheating or things like that. And, you know, all of those things could potentially be scarier things that you could need to get evaluated. And if you've never been evaluated, it's important to do that. But for a lot of the more, you know, the symptoms that could be coming on from anxiety and things like that, the bigger things is just to try to maximize things in your life that could potentially keep that to a minimum instead of just looking for these quick fix hacks.